Hey there, Dr. Christianson here. This is an important topic. I want to talk about what are the best medications for an underactive thyroid. So if you've got thyroid disease and you're on medications, medications are not the whole answer by any means. You want to really address the root cause and get deep in your diet and heal the big factors that you can, but they are part of this. And there's been so many cases to where having the right medication can be a total game changer in terms of the big symptoms, like reversing the weight and getting your energy back and helping with mood or memory or healing the skin or the hair. So sometimes the change can just be complete total game changer, and I've seen that so often. There was a gal that my team saw not too long ago named Samantha. So not really, but yeah, so about 39, she had put on over 23 pounds when her thyroid slowed down, and she just could not lose that. She'd been on Synthroid, on one medication for quite some time, had a lot of hair loss about that as well, but really not progressing. So she saw Dr. Beardsley and was changed from Synthroid to 100 micrograms to WP Thyroid 75 milligrams, or 3/4 of a grain. And I'm sorry, 0.75 grains. So over the course of the next 3 weeks, with no other changes, she dropped 12 pounds. Weight has completely shifted. And about 3 months later, her hair growth was coming back. Energy shifted pretty quickly too. And she started needing less and less of the WP thyroid. So that's a common scenario. But I want to talk in more detail about all the various types and goods and bads of what's out there and just what you might think about yourself. So for the types, the first big category would be the synthetic thyroid medications. And I think synthetic comes off too strongly derogatory. It's a correct category name, but it sounds like they're, I don't know, foreign or natural or weird or not like the body makes. They're actually bioidentical. So they're chemically the same as what your body would produce. But synthetic just means they're made in a laboratory rather than derived from something living. Now, that same standard is true of what we call natural hormones for hormone replacement therapy. So like estrogen or testosterone or progesterone. By this thyroid's definition, they would be synthetic, even though we call them natural because they're chemically identical. So yeah, so Synthroid is chemically identical. It's a bioidentical hormone. But it's one hormone, it's the T4 only. So that's true for many T4 types like levothyroid, Levoxyl, Synthroid, Tirosint, Levo-T, and also generic levothyroxine. So these are all synthetic versions of T4. Then we've got T3 only. The brand name there is Cytomel. That's liothyronine that exists. And there is a medication that's a combination of the two in synthetic form, and that's called Thyrolar or Leotrix. Now, that one's really not commonly found. Pharmacies don't stock it. I don't believe it's even produced on a regular basis, but it exists. And then there are compounded versions of those combinations. So you can get compounded T4 and T3 by themselves or together. So overall, the thought about the compounded is that the nice thing is you could have any amount. So it's not so much just having to go from 88 to 100 because that's the next tablet. You could do 91 if you wanted to. But the drawback is they're not standardized. So there's no real system by which, after they're made, they're checked to confirm that, oh, yep, that came out the way it was supposed to come out. And there are definitely some very good pharmacies that exist. So PCCA is the main thing you want to look for with compounding pharmacies for thyroid medications. They can do it well. But there have been catastrophes, and there have been tragedies. There have been people that have died from compounding mistakes. There have been people that I know that have seen other prescribers that were prescribed compounded thyroid medications that nearly died and actually were in comas for months. So I've seen those things happen. I'm wary of compounded thyroid medication, maybe more so than I need to be, but yeah, the consequences are so large. So there's that. Now we've got the natural versions of thyroid. And the main thing here is natural desiccated thyroid. So this is also called NDT, which is the preferred term for that. Many say Armour thyroid, referring to this whole category. Armour is one brand of NDT, the same way that Kleenex are a brand of facial tissues. So I'm talking about facial tissues, not Kleenex. So of NDT, we've got various brands. There's West Thyroid, NP Thyroid, Nature Thyroid, WP Thyroid, Biothyroid, and Armor Thyroid that exist. There's also generic desiccated thyroid. And there's also compounded desiccated thyroid. So the compounded thyroid, we've got the standardization issue again, and here's a little more of the backstory of desiccated thyroid to make sense of that. So we've got one place called American Laboratories, Inc., and they raise pigs. And they harvest the thyroid gland from pigs, and they freeze dry that. They make that into a powdered form. I'll come back to binders and fillers, but just a quick aside on this. They do add a trace amount of lactose at that stage of processing. The American Laboratories, Inc. does. Now that powder is then purchased by companies that tablet it into a brand of desiccated thyroid like Armor or like WP, or it can be purchased by compounding pharmacies which can then encapsulate or tablet or do what they wish to with that. Now, a couple of thoughts. The lactose is there at the point of raw material. So everything desiccated thyroid has trace amounts of lactose, like a few milligrams, like a few millionths of a glass of milk. So it's there. I don't feel that it's clinically significant. Some companies disclose all their ingredients, including those from the manufacturer. Some companies don't disclose that, and they've made it out to be almost a distinction. So Armor, for example, doesn't list the lactose. It's still there. There's no way around it. So same thing for compounded thyroid. So after it's tableted, the tableting companies have to have it assayed for T4 and T3 content. The drawback about compounded desiccated thyroid is that assay does not occur. And the tableting companies routinely have to discard a lot of their materials because after production, the assay showed that it didn't come out right. Not from their fault, but just normal variations of the raw material. And there's a check and a balance in the tableting process that doesn't exist in the compounding process. Now, the one other source of desiccated thyroid, there's over-the-counter non-prescription desiccated thyroid. A big brand is Thyroid Gold. There's one called ThyroStim. Now, these things are actually a lot like desiccated thyroid, but they're bovine-derived, cow-derived in most cases, rather than pig-derived. And the other big issue is that they're not standardized in the powdering phase or in the tableting phase. And they've been shown to have active hormone, but crazy erratic amounts, sometimes none, sometimes a lot. So not really good options across the board. Now let's talk about these various hormones. So we've got T4, mentioned that one. Many will talk about T4 as really just something to get T3 out of. You know, your body makes T3 and after that, that's all that matters. Well, now the data is showing that T4 is important in its own right. We actually need T4 for the brain, for repair of brain cells. It turns out we need it for bone growth and for repair of the blood vessels. So it's important to have it. And to have only T3 and no T4, there are some critical things you do miss out on. And that's why there can be more risks for cardiovascular issues. T4 does lower TSH levels. We find that in desiccated thyroid, and then all the T4 medications have it as well. Also got T3 to think about. Now T3 certainly is important. It's a big thing for boosting metabolic rate, energy production, also stimulating the heart, and it does also lower TSH. So we find T3 in desiccated thyroid again, T3 medications like Cytomel, and then combinations like Thyrolar or compounded combinations can contain that. So here's the one that's gotten forgotten along the way, and that's T2. So this one is only found in desiccated thyroid. There's quite a bit of data showing that it helps mitochondrial function, it helps the body burn fats more effectively, it helps ovarian function, it helps fertility, and we only see that in desiccated thyroid, and it can be critical in those various ways. It does not lower the TSH. So the relevance is that it is a thyroid hormone, but lacking it doesn't make your TSH go higher. So you don't look hypothyroid, even though you are hypothyroid because you're missing one of those hormones. So that's a big thought about T2. And from my perspective, one of the advantages of desiccated thyroid. Other considerations, we want to think about binders or fillers when we're considering thyroid medications. So these are things that, well, they can just be icky. You know, you want to keep your chemical burden as low as possible. But they can also make it hard to digest. And thyroid hormones are micrograms. They're crazy, tiny physical quantities of things. So if you're not breaking down every nook and cranny of that tablet, you might be missing out on a lot. That can be a problem. Also, those with thyroid disease often can have digestive issues or sensitivities to many compounds. So these odd little binders or fillers, they can be significant. And we can see dextrose, we can see calcium stearate, magnesium stearate, aluminum, lactose in higher quantities. All kinds of odd colors can come from that. So these can be relevant. And they're found in a large number of thyroid medications. Now, a couple of big exceptions. There are two medications that are pre-made that are free of binders or fillers. Tirosint is a T4 only medication that's free of binders and fillers and preservatives. The other one is WP thyroid. So WP thyroid is the raw natural desiccated thyroid powder, but then it's tableted with inulin from Jerusalem artichoke and then medium chain triglyceride from coconut. So those couple of ingredients are all that's there for the tableting besides the natural desiccated thyroid powder. So those two really are the cleanest that are there by far. And again, I mentioned how there is lactose in that, but only the extent to which there is lactose in all brands of desiccated thyroid and all compounded desiccated thyroid, because that's put in at the level of the powder manufacturer. So they all have that. No way to get away from it. Then we think also about desiccated thyroid. So many other brands can have ingredients and additives as well. And we can see colors, many of the FD&C colors that show up in desiccated thyroid of other brands, or also in Synthroid or Cytomel. So the two big ones that are preservative-free, again, are the WP thyroid and the Tirosint. And the binders or fillers, I think, are relevant to those who can be sensitive. And here's a thought, too. If you're on a generic thyroid, the manufacturer may not always be the same each time you get your medicine. So generics are made by someone, they're made by some manufacturer, but many companies can make different generics, and you won't always get the same one. So you may work out that based upon the binders or fillers in this generic, it takes you about 120 micrograms to feel well and have a good dose. But you refill your prescription, and now you've gotten a generic from a different manufacturer, there could be different binders or fillers. So that may not work the same for you, and that's a big drawback. The other big consideration with thyroid medications is variation from batch to batch. Not just binders or fillers, but just different amounts of active ingredients. And nothing is perfect, so medications have an allowable range of variation. And in this case, it's roughly 10%. That's legally allowed. Now, the drawback about desiccated thyroid is that it's standardized for 2 hormones. So that 10% can add up to actually be 20%. Whereas with the synthetics, it's only 10% because there's 1 hormone, with the exception of the Thyrolar. But many manufacturers can voluntarily have a narrower threshold than what's legally required of them. And some can choose to do that, some may choose not to. WP thyroid, West thyroid, and Nature thyroid all target less than 2% variation from batch to batch. So the perk about that is they end up being better standardized than the synthetic medications are, and less variation. So when you figure out what works, it will be that way time and time over and over again. Another big consideration with an ongoing medication is just cost. Generally, desiccated thyroid is not an expensive substance. Most potencies, most brands are in the 15, 20, 30 a month range, pretty typical. Synthetics for brand name can get up there. They can end up being upwards of 60, 70 or more per month. The generics often are less. Then compound medications, these can be all over. Rarely less than 40 a month, but I've seen some in the triple digits or higher, so that can happen as well. A couple other thoughts to just throw out there. Desiccated thyroid, it is porcine. That's a fancy way of saying pig. So if someone really is kosher or halal or strictly vegan, that may not be an ethical fit for them, and they should be made aware of that. That shouldn't be a surprise to them, so that should be made clear. If you are ever changing medications, please be aware of charts like some that I've written that show if you've got 50 micrograms of Synthroid, that's roughly a half a grain of desiccated thyroid. Be aware of those charts, but even then, I tend to be conservative. When you first change over, I often go down by a step or even maybe 2 steps based upon someone's symptoms and blood levels. So a common scenario could be someone who's on 100 micrograms of Synthroid and they wish to change to WP thyroid. In a case like that, a 1 grain dose would be the most exact fit, likely, but people are different. And so I would probably do a 3/4 grain dose initially, but then test them a bunch of times in close sequence and give them any personal fine tuning they might need. Some people on that 3/4 grain dose are going to just be rock solid perfect. I have seen others to where they need quite a bit more than you expect. But this is a case to where there's more of a consequence in overdosing short term than there is to underdosing short term. Neither is good, but the overdosing is the more dangerous of the two. So when I switch, I'll err on the low side and then just check 2 weeks out, check 2 weeks out. And then if they do need adjustments, we'll catch it right away and get it done. And in just a course of a month or so, have it dialed in, rather than have someone take too much and risk cardiac damage or other issues. So good practice for changing. Don't assume that it will be a straight step based upon the prediction. So in terms of action steps, what does this really boil down to? Well, my overall choice in terms of having the 3 hormones, the T4, T3, and T2, being clean, free of preservatives and fillers and binders, and also being well absorbed, consistently manufactured, that would be WP thyroid. Now, if someone is kosher, vegan, halal, next option would be Tirosint for very clean, possibly Tirosint plus Cytomel, which they are generally better getting some T3 with it. Or the third option I would think about would be a compounded combination. Definitely a PCCA good compounding pharmacy, one that's reputable and recommended. And sticking with the same pharmacy as well. So those would be the top ones. In terms of taking thyroid hormones, they are circadian. Your body makes the bulk of this when you're sleeping, and so you want to mimic that. So taking it bedtime or first thing in the morning is the best overall fit. And the trick there is, put your tablet out when you go to bed, put a glass of water out, and right when you roll out of bed and your feet hit the floor, that's when you take your medicine. You can usually end up spending half an hour using the restroom, brushing your teeth, doing those sorts of things. And then afterwards, you're good to go for having your breakfast, having some food. So there's that. Other considerations to think about are just cost, availability, pharmacy access. So the cost is also a perk for WP over the Tirosint and over the compounded. Pharmacy access, here's a wrinkle. Pharmacies don't usually stock WP, but they always can. Now, I have had times where pharmacies have given something other than WP, even when it was prescribed to be WP. So it's not the same as Naturopathic, it's not the same as Westthyroid, it's WP thyroid, and that does happen where pharmacies will substitute. So you've got to take a look and watch for that closely. So hopefully that's been helpful, big overview of all thyroid medications. Please stay on top of your self-exams, your ultrasounds, your tests, and update your symptoms. See where you're at with the thyroid quiz, and if you're not at a good place, you'll get some clear direction on how to get to where you should. Take wonderful care of yourself. We'll talk in really soon. Dr. Christianson signing off.